My name is Abukar Mohamud. I came from Somalia to do some checkups on my medical situation. He diagnosed me by carrying out angiogram, and he reported that there are 3 artery blockages, where one of them 100% blocked, and the other ones 80, 90, around that percentage. I came here, and when we looked at the board names and things like that, we saw this name of Dr. Prateek Bhatnagar, his name and what he does, and he is director of the surgeon and so on and so forth. So fortunately we met Maqsood, who is among his team members. Maqsood has taken us to his special secretary, or care, what we call care patient, I think. So that person, she explained to us what we need to do, and she said, give me all the reports, I will give to the doctor, and then you will have an appointment tomorrow. We agreed with, and we did so. So the following day, I came to the office of Dr. Prateek. What I liked most is he gave us ample time, almost an hour. And he listened to me almost 30 minutes without interrupting about my history and what I'm talking about. I have never seen another doctor doing like that. They were very fast. Most of them, they wanted, in 3, 5, 10 minutes to let you go. So after I finished my history, he kept asking questions, which I have been answering. When he understood the whole story, he gave me the advice. He said, yes, you are not you don't have any symptoms, but 3 blocked arteries has high risk. You may face heart attack. He said, yes, God knows you can live with another 10 years. But normally, based on our experience, such a situation, people, they develop further heart complications, which may cause more damage, which cannot be even addressed at later stage. So I initially wanted to go back, and I said, I just give me medication. I want to go back, and I will do this in Europe. I said, I want to go to Germany. He said, you can do that, but my advice is you take this an action right away, because your situation may not wait for that many months, and medication will not help you. So that is what we discussed. As a family, we made the decision. My daughter decided to travel from Kenya to here, and then we came back to the team of the doctor, Maqsood, Indrajit, Gino, who helped us in facilitating the process, making all arrangements required, payments, other required preparations. And actually that was very nice. So therefore, on Friday, 4th of February, I was admitted to the hospital. and being both in my private room. So that day I have undertaken quite a number of assessments, which are normally pre-operation assessments. And then the following morning, the surgery has taken place. So 5 passes has been done in total. And what's also very, worth noting is the system being used, the method of the operation is called BIMA, which I didn't know, but I just realized it here and I came to know it, is a very, very advanced method of heart operation. No cuts in your legs, no cuts in your hands. All the passes will be drawn from inside your chest, and that was done successfully. I'm now really good. After the surgery, when I became conscious, I have been in the ICU for around 3.5 days. But there was very, very good team. Nurses, doctors, physiotherapists, many people, you name them. And everybody was really very professional, caring, kind, and I was assigned 1 nurses every day. So I really appreciated the service I provided there, and I was moved from the ICU, I think on the 7th, late afternoon. So since then I have been in my private room. Similarly, I have been getting good treatment, good support, and let me say about Dr. Droga. Dr. Droga is the special assistant of Dr. Prateek. She has been very, very useful and kind person throughout, meeting me all the time, checking my situation, giving me advices. And until today, she was the one who was carrying me. So that's all from my end. Thank you very much.
My name is Mr Mohamud. I came here for my father, who recently had a surgery done, BIMA surgery to be specific, by Dr. Prateek. He initially came to India for other medical purposes, but later on was diagnosed with a heart condition whereby he needed surgery done. And we later on found out, after seeking other opinions, we got to know about Dr. Prateek and his team at Care Hospital, and that's how we ended up here. He's had the procedure done. It was successful and it went well. We've had a very good experience here. We're very grateful for the team and the service that was provided to us. Currently, he's doing well, recovering, and we are hoping for the best. We're very happy with the services we've gotten, and very grateful that the disease was caught early, because initially at home he's never had any condition to indicate that his heart had a problem. It was discovered here. So we're all grateful for the interventions and everything that was done.
Hello, I am Dr. Prateek Bhatnagar. I am Director of Cardiac Surgery at Care Hospital, Banjara Hills in Hyderabad. Today we are talking about a very interesting and very important pleasant gentleman, Mr. Abukar. He is a 56 years gentleman from originally from Somalia, but currently staying in Kenya. Now he is a known diabetic for many years, and he developed back pain a few years back, and he came to India to get it corrected. So he came to one of the hospitals in Hyderabad, and during his routine testing, it was found that his treadmill test was positive, which basically means there were some blocks in the coronary arteries of the heart. So he underwent a coronary angiography at that hospital and was found to be having critical blocks in all the coronary arteries of the heart. Uh, he was then given the option of getting a bypass surgery done. He needed a bypass surgery, but then he did his own search and came to know about us. So he decided to come to my team at Care Hospital, Banjara Hills in Hyderabad. So he came over here, and after due tests and everything, we decided that he was a fit candidate to undergo a BIMA bypass surgery, a surgery for which he had come to us in any case. So BIMA bypass surgery is what is called BIMA, bilateral internal mammary artery bypass surgery. The advantage of this bypass surgery is that we can do the entire surgery without making any cuts in the legs or the hands. The other big advantage is the life of this surgery is the longest. In 90% patients, it is working even 20 years after bypass surgery. And these results are much better than using leg veins in bypass surgery. So he had come to us just to get a BIMA bypass surgery with us because he had known that we are doing BIMA bypass surgery routinely in most of our patients. So after tests and everything, we found that he is a fit candidate to undergo a BIMA bypass surgery in spite of being a diabetic. Most of the diabetic patients are actually fit to undergo a BIMA bypass surgery. So we took him up for surgery, and we are very happy that we were able to give him a very good operation. We actually gave him 5 bypasses using BIMA bypass surgery without any cuts in the legs or the hands, in spite of him getting 5 bypasses. So his recovery after the surgery was excellent. He was up and about very soon. The early morning after surgery, he was eating his breakfast, and the very next day he was walking around. Today he is fit to go after surgery at a time when he is already climbing stairs a day before. So basically means 5 days after surgery he is climbing stairs, and just 6 days after surgery he is fit to get discharged. So in nutshell, most of the patients who are having critical blocks in the coronary arteries of the heart, whether they need 5 or 6, any number of bypasses, we can operate them safely by using the technique of bilateral internal mammary artery, that is BIMA, which are spare arteries present inside the chest. We can use them for bypass surgery without making any cuts on the legs or the hands. It is very good for the patient because the patient can have less pain because of minimum cuts, cosmetically better, plus excellent long-term benefits. And also, we do all these surgeries on the beating heart without open heart surgery. So without open heart surgery, we can do all these things as Mr. Abukar got. And we are very happy that his sojourn to India has been successful and is going back to his home country with very pleasant memories of India, of Hyderabad, of our hospital, and of my team. Thank you.